Good afternoon, everyone. Welcome to another interesting session at Spring Meadows Hospital. I'm Preeti Raghav, your moderator for this session. So our today's topic is newborn care. Now, let me take the privilege to introduce you all to Dr. Sanjay Tandon, who is a senior pediatrician and also a medical director at Spring Meadows Hospital. All right, so newborn care. Though taking care of your newborn can be one of the most special and rewarding experiences of your life, you may feel at a loss for what to do and will need to give your child constant attention and care. To take care of a newborn, you need to know how to give your baby the rest, sustenance, and care that she needs, as well as healthy dose of love and affection. Newborns look and feel fragile, and they represent a new world of uncertainty. Most healthy newborns go home after 2 or 3 days, yet the transition of parents is just beginning. It's okay to be a little scared. The first weeks after the babies are born are when they are most vulnerable. Newborns can have multiple medical problems that, if left unattended, can become serious. So now we'll ask Dr. Sanjay Tandon, what are the main essential newborn care practices?
Good afternoon, everyone. I'm Dr. Sanjay Tandon. I'm basically a neonatologist and a pediatrician at Spring Meadows Hospital. Welcome. See, there are a few things which we look after the baby immediately after birth. These babies, we need to maintain the temperature of the room because inside the mother, the baby temperature is maintained at around 37, 38 degrees. When the babies are born, after that the temperature outside is usually much less than what the temperature is inside the room. So the temperature maintenance is most important. 27, 28 degrees inside the room is good enough with a single or 2 layers of clothes around the baby, that is sufficient. We should be avoiding powder, kajal, tel, malish. These things should be avoided immediately after birth. And then you see breastfeeding is the most important aspect at the time, immediately after birth, and as well as the every 2 to 3 hours the baby should be made to feed onto the mother religiously.
So dehydration is sometimes a concern for newborn babies that can continue once they have left the hospital. Parents should also watch for signs of infection in their newborn. Infections can be picked up during birth or from people other than the parents handling the baby, such as visitors. Most people think only of fevers, but newborns can have drop in temperatures or a low temperature that's of concern. So, sir, what are some harmful practices that may cause newborn babies to become sick?
You said that dehydration thing you mentioned. Dehydration, yes, it's a summer time. We do also see that because of the summer, the temperature of the room is more than the normal. So, because we belong to a tropical country where the temperature is 43, 44, the room temperature can go up to 40 degrees. So, if the child is not feeding upon to the mother every 2 to 3 hours religiously, and as well as we have to make sure that the child tummy is through. The child is completely through. If the child is not completely through, then every time the child takes less feed, over the 2, 3, 4, 5, 6 episode, the volume of the water and the milk content goes less. The child starts passing less urine, and the child starts going into dehydration. That's a concern. That is definitely a concern. So we need to look after, make sure that the baby is feeding every 2 to 3 hours on the religious basis. Second thing, you asked us what are the symptoms to look after if the child is getting sick. That's what you mentioned. You see, dehydration, one thing I told you. Second thing, if the child is irritable, uncomfortable, not taking feeds, or the child is lying low or lethargic. These are the signs you should immediately get alert. These are the very beginning. For a mother to see, if you are a first-time mother, you might not understand or notice what is lethargic. But at least basic point you can notice it if my child is not taking 3 consecutive feeds at regular interval, like it's 2.5 hours, 2.5 hours, and 2.5 hours. Almost 7, 8 hours has passed, but my child is not taking feed regularly. At the same time, the child has not passed urine, and the child is not opening eyes, lying low, excessive crying, then you should get immediately alert, visit your doctor, go to the hospital, and complain about the same.
So is formula feeding a healthier option for a newborn?
We really don't think so. Formula feed is one of the options, but the best option is definitely the mother's feed. But you see, initially, if the mother has undergone some problem related to the surgery, related to the postpartum after the delivery, then mother is in no position to feed, then we definitely encourage the formula feed. But in our hospital, in a day-to-day practice, what we do is immediately the child is born, we put the baby to the mother, we encourage breastfeeding, and before the mother and the baby is discharged, we make sure that the feed is established. If due to some other problem, maybe a mother is undergoing some physical trauma because of the some surgical problem having, then you see you can supplement the top feed, formula feed, or in case of surrogacy, definitely we go for the formula feed, and then we encourage mother to give the formula feed. Then it's okay. But ideally, it should be breastfed feeding should be done.
So it's always wise to watch for signs of infection around the belly button or circumcised foreskin, such as poor sucking during breastfeeding, a lack of appetite, poor weight gain, weak crying, and increasing irritability.
Yeah. You see, you were talking about the umbilical. Umbilical cord is one of the things you see, which is the stump. The latest thing is we do not put anything at the stump. When we started our practice, you see, we used to advise for the betadine surgical spirit to be put at the base of the navel, 2 to 3 drops, 2 to 3 times a day. But over the years, we have noticed it. The umbilical stump is very strong area of the baby, and the infection usually does not happen unless it is. We are not very careful. We are not washing our hands and touching the area. Then only you see the infection takes place, and not cleaning the area properly. But the latest is leave the stump like that only. It falls by 5 to 15 days. Once it falls, it gives you a little scary look. Some blood, some pus, some mucus-like thing would ooze from there. But another few days from then, it forms a thick sebaceous secretion, becomes dark and thick, and then it dries up completely. No need to put any surgical spirit or betadine as we used to practice in the past. There are few things which we see that at the stump, if you see that there is redness around the umbilical stump, or if you see something which is growing up near the stump, or if you see that post fall also the discharge is maintained, then you need to see your doctor immediately. But dropping a antibiotic powder also at the navel is not recommended. We should not be doing all that.
So this was the basic care of umbilical cord.
Umbilical cord.
So, sir, another question is how to bond with the baby.
How to
bond with the baby?
What's that? Bond.
Bonds.
Bonding.
Yeah, bonding between the mother and the child.
Between the mother and the baby. Okay, that's good. That's pretty good. You see, bonding is developed immediately at birth. First thing is if you put the baby to the mother breast, that is the first time bonding takes place. And we need to encourage mother skin to skin. That is known as kangaroo mother care. And initially we used to do it with the preterms babies. And every time the baby is hungry and the baby is put to the mother, and the baby latches upon to the mother, and the mother gives direct skin to the baby, that definitely helps initially, immediately after the birth. As the time passes on, baby becomes a few days to few months, then cuddling, putting the baby in the arms, and then trying to have an eye-to-eye contact, even though we know that the baby's full communication is not there, but then we are trying to talk to the baby, trying to communicate baby. These things definitely help. Babies do understand the type of touch, so we should be very gentle and very humble to the baby to approach. So that should be there.
So the jaundice happens in most every baby. Peaking is the first week as newborns learn to excrete the yellow pigment called bilirubin in the stools. Babies tend to have slow liver function at first and may have some evidence of jaundice as their livers quickly mature over the first several days. It's always wise to watch for signs of infection around the belly button or circumcised foreskin, such as poor sucking during the breastfeeding, a lack of appetite, poor weight gain, a weak crying, and increasing irritability.
Yeah. So Preeti, you asked me about the jaundice. Jaundice is definitely there. It does more of a good than bad. So jaundice is why does it take place? We need to understand that. You see, once the umbilical cord is cut, the mother's blood is not flowing into the baby. The baby now makes his or her own blood, and there is no contact with the mother anymore. Breakdown of the mother's blood inside the baby's body leads into jaundice. If there is a discrepancy between the mother's blood group and the baby's blood group, the jaundice level is more. There are four types of major blood groups with the RH, positive or negative, and there are hundreds of minor blood groups. So there has to be discrepancy between the mother and the baby. If the discrepancy is big, the jaundice is big. If the discrepancy is less, the jaundice is less. So for it depends upon it goes jaundice goes at its peak by the fourth or the fifth day of life. If the jaundice level goes to a certain level, then we need to put the baby into the hospital for the phototherapy purpose to break down the jaundice which has been deposited under the skin. If the jaundice does not reach peaks to that level, then most of the time it settles down on its own, then nothing is done. But at the same time, we need to make sure that we need to visit our doctor before the fifth day gets completed so that the doctor can evaluate about the jaundice.
So the bilirubin level generally peaks by about 5 days. For term babies in about 1 week for those born prematurely. If your baby continues to have signs of jaundice, very yellowish skin and eyes after day 4, consult your pediatrician.
Yeah.
Although most babies remain perfectly healthy after they are discharged from the hospital, it is important to watch for any signs of illness and take your child to the pediatrician for evaluation within a day or two of leaving the hospital. So every baby needs to be seen by a pediatrician on day 3rd, 4th or 5th. It is a must.
It is a must. You see, the basic thing is, let's make it very simple. The important thing is how to make sure your baby is fine or not. If your baby is alert, active, playful, sucking well at the mother, passing urine and stool, and sleeping happily. Initially, the baby at birth, from birth till few weeks, 2 weeks to 3 weeks, they tend to sleep around 15 to 18 hours or 20 hours a day. If these things the babies are maintaining very well, you need not worry, your baby is fine. Yes, warning signs are if the baby is not taking for the 3 consecutive feet, like 2 to 3 hours, the baby is not taking 3 feet. If baby is irritable, high pitched cry is there. If the baby is lying low, sust leta hua hai. If the color or the periphery of the skin you see that is not pink, immediately rush to the hospital. If the breathing discomfort is there, immediately rush to the hospital. And if the baby you feel anything other than normal, what our signs have told you, it's better to be seen by a doctor rather than staying at home.
So what are the important vaccinations for a newborn?
Yeah, you see, the newborn time is from birth to the first month of life. Immediately you see at birth, most of the hospitals, they give the vaccine and then they send the baby home. So at birth it is BCG, polio and hepatitis B, which is done by all the hospitals. Next vaccine dates comes usually by at around 1.5 month of the age of the baby. So at 1.5 months, you need to go back to your pediatrician and get an injection, which is a combination of 5 to 6 injections together. Along with that, there is one rota that has to be given. Most of the hospitals, they do it. But initially from birth, after the vaccine has been done, and the 4th or the 5th day, you need to visit your doctor. That is immediately after birth. And then by 4 weeks, 3 to 4 weeks, you should visit another visit to the hospital or to your pediatrician. The reason is to see whether the weight gain is there or not. And the doctor needs to see whether all the parameters which were inside the mother and outside the mother, the heart and all has got little changes here and there, which is most of the time normal. The doctor evaluates that also and sends you, comforts you, and sends you back. And vaccination should be at 1.5 months of life. Next.
So we have a viewer, Mr. Gaurav Singh, is asking, is it normal for a newborns to be congested and sneezing?
Congested. Gaurav, congested is a word I didn't get. Congestion means congestion you are talking, if I understand you correctly. See, sneezing, coughing, yawning, and hiccups. These are good. These are good. That doesn't mean that the child has got cold cough. If anybody who is having cold cough, including mother, should avoid contact with the baby or newborn. But yes, if mother has developed cold cough, she can put a scarf onto the nose and the mouth and she can breastfeed. Breastfeeding is not stopped. And to your coming back to your question, sneezing and coughing and yawning and little hiccups, this does not mean that the child has got cold. Sneezing could be because of the stuffy nose. Put nasoclear or saline into the nose so that the breathing is easy, so that the baby can work up onto the mother well. With the stuffed nose, the child is uncomfortable, cannot work up to the mother.
Okay. So Nidhi is asking, when can someone take the newborn out in public?
Yeah, that's a thing. You see, ideally it should be 4 to 6 weeks. After that, the mother should be taking out the baby. There are two aspects of it. You see, first 4 weeks the baby should not be traveling, and 6 weeks for the mother also, that the mother should avoid traveling, because the uterus size has to come back to the smaller size. Pregnant uterus and non-pregnant uterus comes back to the normal size by 6 weeks, and the babies they are vulnerable. So before 6 weeks, one should avoid traveling with the baby, unless it's a compulsory, you have to travel, then you can.
So Chaya is asking, do babies sleep very deeply?
Initially, yes. Initially, yes, for the first few weeks, and after that, they have very, very short sleep. They get it with a small noise. They can immediately get up also. Initially, for the first few days to 2 weeks onwards, first 2 weeks, they can sleep around 15 to 18 hours a day, and by around 4 weeks to 5 weeks, they tend to sleep around 10 hours a day. So you see, as the number of days keeps on increasing, the sleep goes on decreasing. And since they are not exhausted much, because they are not walking, they are not doing physical work more other than breastfeeding and peeing and pooing. So you see, if they sleep for 4 5 consecutive hours in the night or in the day, then they take a nap of half an hour, 40 minutes here and there, and most of the time they are awake, and then they get away early the moment little noise is made. So that's okay. That's all fine.
So Bhavya has another question. If crying helps develop baby's lungs, should you comfort them immediately?
See, it depends. Like crying helps in developing the lung, but that does not mean that we make our baby cry. No, no. You see, you need to approach to your baby immediately. You have to see what is the reason for the cry. See, normally the baby is hungry, either baby is wet, or the baby is little in a discomfort position. So these are the basic things. After that, the baby is crying. It is our duty to hold up the baby to the shoulders, pat the back, and give a soothing effect. Then we are trying to develop the emotional connect with the baby. And such babies, they are more comfortable, emotionally stable when they grow up. So we should comfort our baby. We shouldn't let them cry alone.
So Anita Mathur is asking, how can I keep my baby from getting diaper rash? How should I care for my baby's belly button?
Okay, diaper rash. See, we need to keep the babies dry as